injury or even an accident led to debilitating back or neck pain? Well, you may need the help of a team of doctors who understand how to treat a number of spine-related conditions. Dr. Basem with North American Spine joins us this morning along with patient Alton Maiden. Good to see you guys. Thanks so much for being here. Alton, let's start with you. Let's talk about your condition before the surgery and your experience overall at North American Spine.
Well, over the last 3 to 5 years, I've been having this pain that's been radiating through my back, down my leg. Discovered that it has something to do with my sciatica nerve. And as a matter of fact, when I was my daily activities, people would tell me that I'm walking funny, actually walking like a question mark. And so I've been dealing with this, have gotten injections, went to chiropractors. They tried to do some manipulation, but everything I did didn't work or was temporary. And so I was introduced, referred to I call him Dr. A, and he was telling me about this procedure, and it's non-invasive. And so when I did it, I was a little nervous, apprehensive, but when I went through the procedure, I can tell you it's one of the best decisions I've ever made. You
mentioned minimally invasive. Doctor, let's explain what exactly that is. I don't know if everyone really understands the difference between minimally invasive and open back surgery.
Right. Well, minimally invasive, at least the minimally invasive surgery we provide, involves a very small incision that we make right here at the lower part of the spinal canal.
Okay.
Through that incision, we'll enter with a fiber optic HD camera that'll pass into the spinal canal, kind of in front of the spinal nerve roots and the spinal cord here, and is able to identify where the problem is. Essentially, we've already kind of had the imaging and all the testing beforehand, so we got an idea of it. But with the camera, we can actually now visualize exactly what it's affecting and how it's affecting it. Through that camera, we utilize laser that will actually come in and vaporize either scar tissue or disc protrusion or a disc herniation or whatever the problem may be, thus alleviating the symptoms.
Let's talk about some of those problems and conditions that you're able to treat with minimally invasive surgery.
So some of the, we treat the lumbar, cervical, thoracic spine, and those things include a degenerative disc disease, kind of a broad label, disc protrusions, disc herniations, spinal stenosis, scar tissue, as I mentioned, many more. And all that information you can get online as well.
The way you explain it makes it seem like it's extremely easy on the patient. I would assume that makes a big difference in recovery time. Tell us a little bit about that process.
Absolutely. The recovery time is much quicker than open back surgery for these patients. So they get back to work, back to playing with their kids and everything else much, much sooner. And also the complication rate is far less than that of open back surgery as well. So it's advantageous on multiple aspects.
Yeah, so Alton, your life was obviously greatly affected by this. Nothing was working. What is life like for you now?
I smile when I say that. Yeah, I can do so much things. I don't have any limitation. I'm a fitness trainer, so being able to train myself and then train my clients is a lot easier with the ability to be able to do anything without any restriction, without any limitation at all.
You know firsthand what it's like to go to a lot of different doctors, so what would you say to people out there this morning who may be struggling with that debilitating neck or back pain and are maybe hesitant to do something about it?
And like myself, I was hesitant also, but I would tell them from my personal experience with this, as a matter of fact, I actually recommended somebody just yesterday because my life has changed tremendously. My ability to do the things, to play with my kids, to go out there and do whatever I can do.
What you need to do, just life in general.
Yes.
We want to thank the two of you for coming on. You're a true success story. All right, for more information about North American Spine, you can give them a call, 214-880-6416, or you can log on to NorthAmericanSpine.com.